Good day, grade 10 students. Welcome to our health class. The World Health Organization, way back 2015, was able to come up with 8 Millennium Development Goals. So we have these goals, we have this goal to protect our people, protect ourselves from the different health issues that worldwide is experiencing. So those are the things that I have mentioned: the TB, the dengue, the malaria, the COVID-19, and a lot more. So number one goal, what is the goal of the World Health Organization as part of the 8 Millennium Development Goal is to eradicate extreme poverty and hunger. So the objective of World Health Organization is to eradicate extreme poverty and hunger. We want our people to uplift their living. So how are we going to eradicate extreme poverty and hunger? So we have programs. World Health Organization has a program on how to uplift the living of the people. So if we are living okay, we have work, we have job, at least we are getting away from extreme poverty and hunger. So we don't need to be very rich on how to achieve this goal, but at least we have programs to give livelihood programs perhaps to the people so that they have work, they have a source of income so that they can eat 3 times a day and they will never feel hungry. Okay, so um, most especially, this goal is for the countries who are very known as very poor, just like the Africa and some countries in Asia. Okay, so we have programs for that. What are the suggested program? We have education. So you need to be educated. How could you work? How could you find a good job if you are not studying, if we don't have any education at all? We have promoting gender equality. So if men can do it, why not women? Our goal is to make everybody understand that we should all treat people equally. That's why we have policewoman, we have pilot who is female. So that is what we call gender equality. So if we were going to focus only for the men, so what about those people who has no male at home? Another is to produce more jobs, investing more in agriculture, strengthening nutrition programs for children and infants, and supporting and developing countries during crisis. Number two is we have achieved universal primary education. Persons, particularly women who are educated, are more likely to seek medical care, especially during pregnancy, ensuring proper nutrition for their family, adapting healthy sanitary practices, and ensuring immunization of children. As an effect, infants and children have a better survival rates as healthier and better nourished. If these are attained, children who receive primary education are more likely to marry and have their own families at a later stage in life, practice family planning, and have fewer children, know rights, responsibilities, and civic obligations, seek employment, and sustain personal and family needs, have decreased risk of getting sexually transmitted infections like HIV, AIDS. So if we have education, if we are educated, we tend to uplift our living through these learnings that we have learned from the school. And nobody will hire you, the companies or any other establishment. Companies will never hire people who do not have education. There are some companies who don't hire people who are not able to finish college. Okay? So that is very hard if we do not have education. That's why we continue to impart you some knowledge so that in the future, you could also be like us, like other professional who could uplift their family to avoid and to get away from being hungry, being so poor. So next is we have to promote gender equality and empower women. I have mentioned this already. So we always have to think that we are all equal. Men, women. What women can do, men also can do that. What the men can do, women can also do that. So let's have to practice gender equality. So let's not underestimate the women. For example, you say that only men can be a leader, only men can be a military. No. At this point in time, our goal is to help one another, encouraging them, motivating them, everyone, regardless of the gender. That everyone could do, everyone could excel, everyone could uplift one another despite of their gender. Next is we have reduces child mortality. This program and policies which help reduce child mortality like improving nutritional intake, healthcare facilities and infrastructure, and programs and policies is one way to reduce child mortality. These include immunization programs, assuring the survival and better health of mothers, improving reproductive health programs and policies, better nutrition programs for infants, children, and mothers. So this is also very important. Why? Just like today, the government is giving a free immunization. The government is giving free vaccines for the people. These vaccines are just the same as the immunization that we have when we were still a child. The dengue vaccine, the TB vaccine, the malaria vaccine, the polio vaccine, these are all the same. These are all the same, which has the same objective, is to protect us from these worldwide health issues. So we encourage everyone, we are educating everyone not to be afraid of the vaccines. So some of us are very much afraid of the vaccine because we thought of the reaction. Yes, there is, and there will always be a reaction because all medications, all medicines, all vaccines that are injecting to us will always have a reaction to our body. So let's not be afraid of the vaccine because vaccine is a support or it will going to increase shield on our body on how to protect those viruses. But it does not necessarily mean that we will be totally be free with those illnesses, with those viruses. No, that will just serve as a shield, as I have said, and a protection. So let's not be afraid of any vaccines. Let's put it in our mind that our vaccine was made to protect us. And the government or the medical teams will never give you things that might hurt you or might give you a bad effect. The effects are very natural because just like the COVID-19 vaccine, we induce virus COVID in your body so that we will be immune. So the vaccines are also good viruses that was being injected to us so that we will be immune with that certain virus. Okay? So we also have to improve maternal health. Maternal health means to say this is a program for the mothers who gave birth, who is giving birth, or who is pregnant. It is not only about mother's health, but also involves the health and wellness of the family. Maternal health also helps eradicate other problems like poverty, gender, inequality, decreased workforce, lower birth deaths, and disability of women. Some ways to improve maternal health include improve and proper nutrition of mothers, teaching the benefits of birth, spacing and small family size, educating young boys and girls about the importance of maternal health, better and improve access to hospital care, especially obstetric, gynecology, prenatal and postnatal care. Six is we have combat HIV, AIDS, and other diseases. Okay, so emerging and re-emerging diseases like HIV, AIDS, malaria, influenza, and other diseases affect productivity and growth of nations. Some of the effects of disease outbreak are loss of jobs, shortage in professional workers, and in creating social crisis. Children are the most vulnerable and are exposed to exploitation and abuse, undermining their normal growth and development. Some ways to combat disease include effective prevention, treatment, and care, like improved housing condition, increases access to anti-malaria medicines, promoting safer sex behavior and preventive education for all, promoting tuberculosis or the TB, screening of HIV/AIDS person and TB directly observed, treatment short. This is what we call TB dots. Course therapy. Next is we have ensure environmental sustainability. Investing and promoting sustainable energy like solar, wind, and water energy help support jobs, create business opportunities, and save remaining non-renewable energy sources. Environmental sustainability assures people to live healthier and enjoy a clean and green environment. Some of the benefits of a sustainable environmental are cleaner air and environment, clean environment and friendly, renewable energy, new and aspiring jobs and business in energy, increased access to sanitation. Global Partnership for Development. The United Nations, World Health Organization, World Bank, and government works together to make sure that there is fair trade and that heavily indebted countries obtain relief and funds to combat poverty, malnutrition, and funds for education and social projects. Some benefits of global partnerships are expanded international trade agreements, improve access to affordable medicine, reduce poverty through a government debt relief grant, and develop information and communication technology or the ICT infrastructure. Plus, one of the benefits of the globalization to the world is the development and improvement of various health initiatives by different nations and governments to address health issues and concerns. Global health initiatives are programs set motion by United Nations to the World Health Organization in partnership with the World Bank, which target specific health problems, including but not limited to emerging and re-emerging diseases, climate change, environmental sanitation, mental health, tobacco regulation, and alcohol use. These are very important, class, because we were able to come up with initiatives, goals, through the ideas of the different leaders of the different nations. Of course, by the help of the World Health Organization and the World Bank. So we are very lucky, guys, that we have organizations like this thinking for our own safe, thinking for our own good. What are we supposed to do is to follow and understand what they are teaching and what they are educating to us, because this is very important and this is for us, especially this time that we are experiencing this most communicable virus, and it's very dangerous, very deadly, the COVID-19. So I am actually asking everyone to please support our government, support our leaders in the community by following the protocols. Wear your mask, stay at home, social distancing, avoid roaming around. Always bring your alcohol or sanitizer and apply it in your hands. Do not put your hands inside the mouth without even sanitizing it. If we could wear gloves, let's protect ourselves, because if we will going to protect ourselves, we are also protecting our family, the people around us. our loved one. So by protecting ourselves, we are protecting the whole family, our whole family, the community, and the whole world. So keep safe and always stay at home. Goodbye.